I think it was 6 years ago, Dr. Marsha Martin flew down from Oakland, and she said to me, your infection rate is so high in this region of California that at the CDC, we're talking about it. And we're testing everybody in Baton Rouge, we're testing everybody in Miami, Brooklyn, the Bronx, and right now we're focused on Oakland. And I have flown down here today to tell you, you need to test everybody in this region of California. Well, that was a very tall order, but it was truly Dr. Marsha Martin's inspiration that got all of us at Desert AIDS Project to start to talk about what it would take to do it. We knew from the get-go that we were going to have to find over $5 million in funding in order to pull this off. And as I think many of you know who've been in the Coachella Valley for a long time, our deepest partnership when it comes to healthcare has always been our hospital in Palm Springs, Desert Regional Medical Center. At the beginning of the epidemic, when we needed a hospice in our community, because we had so many young men dying, Desert Regional Medical Center took the entire third floor of their hospital and gave it to our community. If you're an interior designer, or if you were part of this community in the 80s, you know each room was decorated by a different interior designer. And so they were all completely different. If you know Willie Ryan, who runs the restaurant downtown Palm Springs, he had a room and he made it Southwest and had a Kiva fireplace that was just like out of Santa Fe. And if you ever talk to Willie about that story at 849, he will tell you about witnessing young people pass in there and their families coming to be with them and how important it was. That's the contribution he played. Let me get back to Desert Regional. So we went to Desert Regional Medical Center's CEO at the time, Carolyn Caldwell. And we said to her, we need someone to make an enormous gift, to set the tone in this community that it can be done. And Carolyn said, all right, we'll do it. What is it that you need? And I said, I was so nervous because they had never given at this level anywhere in the United States from corporate. I said, we need $1.5 million. And Carolyn said, I'll get it. I'll fly to Texas and we will talk to the CEO. And sure enough, they were completely on board. And that started the campaign. So let's give a round of applause. I see the hospital here today. Our next large healthcare partner, who has always been a part of our organization, is the Desert Healthcare District, right? They are the district and the foundation that funds healthcare in this region for low-income people and people in need. And they were the next people to step in to fund this campaign. So let's give a round of applause to the Desert Healthcare District. And Susan, just on cue, because I was just going to give an acknowledgement to Susan.
Oh, no, I was just waiting.
Well, it's too late. I got your hand. Right? We needed somebody who had that same level of passion as Marsha Martin had, as Baton Rouge, as the Bronx and Brooklyn had. And Susan, for those of you who don't know, has been a board member of Desert AIDS Project. She was the founder of the 100 Women program. And one morning we had coffee together. And I didn't say, will you work every day of the year for the next 5 years to help us in the epidemic? But whatever I said, she said yes to it. And for the last 5 years, I swear she hasn't taken a day off to be the leader of this campaign. So Susan, thank you so much. Dr. Kaiser, thank you for being our steadfast partner. Had you not been right by our side, we wouldn't have accomplished what we accomplished. So Riverside County has always been committed to ending this epidemic, and we're so fortunate. So thank you, Dr. Kaiser. Tamara Brockman from the State Office of AIDS, where were we to find an angel who at a moment's notice would get on an airplane from Sacramento and meet with the leaders of all the hospitals and all the healthcare organizations, create PowerPoint presentations and show them how many people were going through their emergency departments every year not knowing their HIV status. It was because of CAMA that all the hospitals and healthcare organizations joined this campaign. So CAMA, thank you so much for that. And I know Senator Boxer has left the room, but we all know it, right? If you're a Californian, you know because she made this an enormous part of her public service. We prevented hundreds of thousands of infections in San Francisco and saved hundreds and thousands of lives because of her leadership. So let's acknowledge what she did with her career for this community. It goes without saying we're very lucky to have Dr. Ruiz representing all of us in Washington right now. I know if you follow him on Facebook, you know what I know, in that he is so passionate about protecting the Affordable Care Act and the Medicaid expansion. That is his primary motivation right now. We need him more than ever, and he's the perfect person for that job. So let's all give him an applause and our love for what he's doing. So I'm very excited to share the results of these 3 years of work, and it's just the beginning. But before I get there, I need to read a letter to all of you from President Bill Clinton. Greetings to all those gathered at the Get Tested Coachella Valley results and rally to celebrate the successes of this community-driven campaign to reduce the spread of HIV and to end this epidemic in your region. I'll never forget visiting Desert AIDS Project in 2014 and touring your mobile health clinic. I'm proud that Get Tested Coachella Valley remains an important part of the Clinton Health Matters Initiative's blueprint for action. What makes Get Tested Coachella Valley truly unique is that while most HIV testing campaigns are launched in major metropolitan areas by their local government, this campaign is led by a coalition of 100 community partners. By working together to make HIV testing accessible, linking those who test positive to a robust network of care, and combating stigma and prejudice surrounding HIV, you're not only saving lives in your region, you're providing a replicable model other communities can use to save lives nationwide. This epidemic has been with us for more than 35 years. But work like yours proves that we can defeat it if we work together. I believe that a world free from HIV is within our reach. If healthcare providers make voluntary HIV testing routine, if patients learn more about PrEP and prevention, if we encourage friends and families to get tested, and if more communities follow the example of Desert AIDS Project and Get Tested Coachella Valley. So thank you for your tremendous efforts to get everyone in your region tested, and best wishes for much continued work. Signed, Bill Clinton. I want to just take a moment to thank Tricia Gerling. She is the Director of Community Health at Clinton Health Matters Initiative, the Clinton Foundation. As many of you know who've been through this all along the way, Tricia and the team ensured that we were invited to the table when they wrote the blueprint for this region of California. And Get Tested Coachella Valley became one of the main priorities to ensure would achieve success. And so it was because of your faith in this initiative and how you prioritized it that we were able to leverage that throughout the community. So Tricia, thank you so much. Okay, on with the show. Oh no. I need help. I'm gonna quit pushing. Will you help me, please? I need the clinical testing slide. Oh, there we go. So this was strategy number one for this campaign. When we came together to set our agenda and our goal as community partners, we knew that the number one place that we could literally get thousands of people tested in this community was through our healthcare settings, right? We knew if clinics and hospitals and medical providers would sign on to test everybody in their patient population over the age of 12, which was the CDC recommendation, that would be our first enormous step. So I want to acknowledge the work of our public health liaisons, because by year 3 of this campaign, 40 medical facilities have made HIV a routine standard of care, and 170 physicians have signed our partnership pledge. So please join me in acknowledging all the public health liaisons in our room for their hard work. This, of course, has changed behaviors and it's changed attitudes in the healthcare community. And HARC, our third-party evaluator throughout the campaign, recently completed a survey, and we were so delighted to see that 0% of local medical providers agree with this statement that routine testing is not very important. Thank you. So our next strategy was to go out into the community, right? If you were in that room, you remember that conversation. We knew in these 3 years, not everybody would receive health care, right? Some people wouldn't get an annual exam. Some people wouldn't be in an emergency department. And so people would not get tested for HIV. So we needed to go to them. So we started opening community test sites that would be there permanently, such as at Martha's Village or at the Mecca Family Resource Center. By year 3 of the campaign, we increased the number of free community testing sites in the Coachella Valley to 78, which is a 2.5 times greater increase than when we started at the beginning of this campaign. And in 2016 alone, we tested over 5,000 people in these sites. And that's an 86% increase compared to our pre-campaign numbers. So we also joined pre-existing festivals, dance parties, health fairs, and we brought the mobile clinic to pre-existing events going on. During the 3 years of work, we went to roughly 300 community events. That's one community event every 2.5 days for 3 years in a row. So please join me in acknowledging all of our volunteer and staff who are testers and part of Get Tested Coachella Valley. They haven't had a break for 3 years. You've done an incredible job. So when you combine all the testing we did in the clinical hospital settings in the Coachella Valley with all the community testing that we did, you get to some pretty extraordinarily impressive numbers based on the reports that we've received back. So the data we have shows that over 80,000 people in this region have been tested in the last 3 years. Now, to put that in perspective, when you look at how many people live here over the age of 12, which is our target audience, there's about 300,000 of them. On an annual basis, we achieved a 49% average increase in testing compared to pre-campaign numbers. Out of those 80,000 plus folks, we identified 482 people who were living with HIV who did not know it. Now, no one can accurately predict just how many people were living in our valley who were unaware that they were living with HIV prior to campaign. But no matter how you look at it, that we have found at least nearly 500 folks and been able to provide them care is an enormous public health benefit and individual benefit to the Coachella Valley. In all of our testing sites, our positivity range is right up there on the board, 0.13 to 2.19%. Now, the CDC considers that you have a cost-effective testing site when you find one person per 100,000 in several, per 100,000, thank you, Susan. 1,000, thank you. Several clinic sites that are testing right now in this region are finding 2 folks per 100. So even more inspiring is that only 8 data sources are sharing their statistics back with the campaign. And we know there has been testing going on through this effort in a lot of other sites in this region. So we can assume even more people were tested and even more people learned that they are living with HIV and got connected to care in the last 3 years. Now, if you are following what's going on in science and healthcare right now as it relates to HIV, you know today there is only one reason that the virus passes, right? And that is because the person is not in healthcare, is not receiving HIV medications, and hasn't achieved viral load suppression. So for this reason, testing was extremely critical, but equally to us was linking folks into care, ensuring that they were in care and retained in care in the campaign. This is one of the main reasons that, as Barbara Boxer spoke about, the Affordable Care Act is so critical to ending the epidemic. Get Tested Coachella Valley early intervention specialists linked 88.4% of patients who tested positive into care during the campaign. This far exceeds both the national and state averages. So let's give a huge round of applause to the intervention specialists who are in our room today. Hundreds of people who tested positive during the campaign are now on medication and linked to care. For them, their families, and their loved ones, this outcome is beyond measure. HIV positive individuals whose virus is reduced to undetectable levels cannot transmit the virus to others, period. While there's no reliable statistic for the number of new infections averted for every HIV positive individual identified, we can say with reasonable certainty that we have averted hundreds of new infections in our region. So when you look at the lifetime cost of living with HIV, which is estimated at $380,000, and you put it into our equation, you can safely estimate it that we have saved our community $190 million by the success of this campaign. Our cost per new HIV diagnosed was $11,400. According to the CDC, when you compare this, it is extremely favorable to other testing initiatives going on in the nation, some of which are double that figure. As Bill Clinton said when he spoke in 2014 to all of us, there's no one person who is more intelligent or has more power that when you bring a group of committed individuals together who are rallying around a purpose greater than themselves. In my opinion, this room represents our best thinking, our best work to end the HIV epidemic in our community. Get Tested Coachella Valley is something that we should all be very proud of. We should continue to commit to its goals. And we should also replicate this model for additional priorities for the betterment of humanity and for our globe. Thank you all very much.